now to be 130 million. So it is very clear that the rate of poverty is increasing. And if you look at the rate of growth of economy is going the other way in a reverse gear. So the more we move towards attainment of the universal health coverage, with the little resources we have, the more the poverty is expanding, the more people that will require to be included in under the vulnerable segment of the populations are increasing. Yet, as we work towards achieving this ambitious target, every day, more and more Nigerians are pushed into deeper and deeper into poverty by out-of-pocket payment and catastrophic health expenditure. Many of us here are gradually increasing in age and approaching retirement, which invariably may be associated with the reduced productivity and increase in health, resulting in relatively higher expenditure of health and more reliance on the public health system. We therefore owe it to ourselves and our fellow Nigerians to develop and maintain health system that we desire and require, both now and in the years to come. With the other challenges of inflation, unemployment, brain drain, high cost of medicines and limited health insurance coverage, as well as the double burden of communicable and non-communicable diseases that characterizes our epidemiological transition, we are therefore constrained to make this commitment a reality. If you look at our epidemiological transition situation, if you compare the developing countries and developed countries, they have moved to a level of a certain stage of epidemiological transition with very low communicable disease and high prevalence of non-communicable diseases. But unfortunately, in our own environment, while the non-communicable diseases that hitherto on the low level now is on the increase, and without commensurate decrease in communicable diseases as we see in a developed economy. So we are now faced with double-edged sword. We have to confront the non-communicable diseases while we are confronting the communicable diseases. And therefore, if you want to do a simple analysis of the benefit package between the developing low-income countries and that of high-income countries, you will see that their benefit packages under their health insurance is populated with non-communicable diseases. Whereas in our own, we have to combine the non-communicable and communicable diseases. Yet, we must remain undaunted and continue to strive for improved access to quality healthcare and better health indices for Nigeria. In doing this, we must take cognizance of the fact that all actors within the health system must work together in harmony, including local and international actors, the federal and sub-national actors, the supply and demand side, the public and private sector, and so on and so forth. In addition, we need the support of sectors that are outside the healthcare system, such as finance and budget. That's why we are happy that our very good friend is here today. We must also develop relevant policies and make efficient use of available resources to ensure equitable access to basic healthcare services in the spirit of leaving no one behind. I wish to, at this juncture, thank His Excellency President Muhammadu Buhari and the Honorable Minister of Health, Dr. President Muhammadu Buhari, GCFR, and the Honorable Minister of Health, Dr. Osagi Ehanire, for their unrelenting commitment to the attainment of universal coverage in Nigeria. Most especially, we are grateful for signing the National Health Insurance Authority Act into law by Mr. President on May 19, 2022. The signing of this NHIA Act repeals the former NHIS Health Insurance, National Health Insurance Act of 2004, with all its associated challenges, including its bias for formal sector coverage, voluntary participation, and no clear provision for the coverage of the vulnerable. The new NHIA Act, on the other hand, has fulfilled the two basic critical requirements for universal health coverage. What are these two critical requirements? Number one, you must have a mandatory law so that nobody will have capacity to join the health insurance and can contribute in ensuring effective crop subsidization will be left behind. Secondly, the law has made provision for the vulnerable segment of the population. So if we have a law, and that law contains the provision for the vulnerable population,